अस्सलाम वालेकुम, इय्याका नअब्दु व इय्याका नस्तईन। वेलकम टू माय चैनल डॉक्टर शामी सेज। तो इस वीडियो में मेडिसन 22 फरवरी आफ्टरनून का पेपर मैं करने जा रहा हूँ। तो चलें स्टार्ट करते हैं। क्वेश्चन नंबर 1, द सेरिबेलर डैमेज साइन इज़ डिसमेट्रिया। Question number 2, which of the following lung volumes or the capacities can be measured by the spirometry, that is the vital capacity. Question number 3, a young boy came in the ER with the profuse bleeding from the minor trauma. He has the complaints for the last 6 months. There is no family history. He has also diarrhea. Diarrhea bleeding time is 6 minutes, clotting time 30 minutes. Most likely cause is vitamin K deficiency. Question number 4, 11-year girl was sent to radiologist for the X-ray elbow joint to diagnose the age. The secondary center of ossification last to appear in the her humerus is beta, that is a lateral epicondyle regarding blood supply of the brain. Charlie, which is the branches of cerebral artery, does not anastomose after entering the brain substance. Next, question number 6, the female patient presented with the pain hypochondrium exploratory laparotomy was done with the slow, which showed that the ovaries were attached to the lateral pelvic wall, which structure in this area has increased risk of damage during the procedure. That is Charlie, that is internal iliac artery. Question number 7, unmyelinated nociceptors primary efferent fibers synapse directly which neuron of the spinal cord? There is alpha spinothalamic neuron of the lamina 1. Edema of the renal origin is most likely due to albuminias and the sodium retentions. Question number 9, an extradural hematoma artery involved will be delta, that is middle meningeal artery. Question number 10, the buccopharyngeal membrane separates oestomodium from the foregut. Question number 11, location of the geniculate ganglion is beta junction between the internal acoustic matrix and the fascia canal. Question number 12, when accessory cervical rib arising from the transverse process of cervical vertebra may cause the damage to delta, that is the T1. Question number 13, the nitroglycerin is not given orally because of extensive first pass metabolism by the liver. Question number 14, hyperfunction of the thyroid is suggested by the marked tachycardia. Next, question number 15, a young medical technician had a history of acute eczematous dermatitis on his hands by wearing the latex gloves. Skin was dry and crusted, thickened. Eczematous reaction was clear after 2 weeks, but returned after 72 hours back in the job and started to grow. This is an example of type 4 hypersensitivity. Question number 16, Goodpasture syndrome associated with peripheral linear IgG deficits. Question number 17, a 38-year-old female complains of the wrist pain and the numbness in index and the ring finger movement of with the falling muscle of the hand is affected, that is beta abductor pollicis brevis 18. A group with the disease and another group with no associated disease. What type of the study is this? That is the case control study. Next, question number 19, the young male had an RTA which resulted in the femur fracture. He died 5 days later. Autopsy showed cerebral petechiae. Diagnosis, the beta, the fat embolism. Question number 20, a PPD tuberculin test done to the patient after 40 hours. 15 arrhythmia is noticed. Cells responsible would be the helper T cells. Question number 21, the professionalism of the doctor can be best assessed by the punctuality and availability of the patient. Next, lengthy scenario of the Kingston Oval cricket match, and the woman has developed the Malheur rash. A skin biopsy shows immunofluorescence positivity along with the dermal abdominal junction with antibody to C1. Which of the following complication is most likely developed here? That is the pericarditis. The 23, the female had the pick cardiac transplant 6 months ago, acute cellular rejection, acute moderate type. Which findings are present? That is the beta lymphocytes in the myocardium. 24, the woman has a man has noted the secretal icterus for the 4 days, malaise for 1 month, examination, tachycardia and the vitals. Normal rest of physical examination, remarkable lab findings show the hematocrit 25%, that is the intravascular hemolysis. Next, 25, microscopic slide stand with the Kagel method shows cells in the gray matter which had the long branches of the processes occupied most of the internal neuronal space in the perivascular feed species. Which type of the cell is this? That is the protoplasmic astrocytes. Next, question number 26, a 12-year-old boy with the hemophilia A has the episode of pain in the knee for the past 6 years. Over time there has been an increase in size of his knee joint with the deformity. Lab studies show the decreased level of coagulation factor. Number 8, activity of the following is likely to be seen within the joint space following the episodes of pain. That is the cholesterol crystals. 27, ACE inhibitor is given to the patient. It increases the renin bradykinin. By which mechanism bradykinin increase, that is stimulate the kallikrein mechanism. Next, 28, 40-year-old female, the heavy bleedings in 6 months, endometrial biopsy shows endometrial hyperplasia. The cause is Charlie, high level of estrogen. 29, the true both the skeletal muscle is it's wrong, you have to correct it. It's beta, the belly is fleshy all long length. 34th, heart sound is due to alpha, which is the arterial contraction causes ventricular valve vibration. Next, 31, young adult received crush injury to his foot, which became infected and necrosed, for which BK was carried out. 6 months after the amputation, the patient developed a tender haphazard bundles of the nerves with pain at the site of amputation. The nodule most likely is the delta. There is a neuroma. The 32, the characteristic diagnostic test for the folate deficiency is the RBC folate level. 33, the patient was operated for the splenectomy. Finding in the immediate phase will be the thrombocytosis. 34, the lung compared to the systemic circulation has beta, the decreased resistance. 35, 50-year-old man does strenuous work on a hot sunny day, suddenly collapse due to alpha, which is the excessive sweating. Next, 36, the strong chemotactic agent for the neutrophils is E, that is C5a. 37, the re-entry circuit occur due to which of the following? That is the paroxysmal nodal tachycardia. 38, which of the following is associated with the water diuresis? That is delta, the positive water clearance. 39, the important natural defense mechanism against the neoplasia is the beta apoptosis. 41 of the following is the feature of apomotor neuron of the facial nerve, that is Charlie, ability to wrinkle the forehead on the affected side. 41, the predominant stimulus for the activation of the hypoxic pulmonary vasoconstriction is beta, decreased partial pressure of oxygen. 42, the progesterone is the precursor of aldosterone, cortisol, corticosterone. 43, the brain disorder marked by the gradual deterioration of the mental capacity, memory impairment, and the confusion. The CT scan, there is atrophy of the brain. This disease is Alzheimer's. 44, the patient presented with the UTI culture shows the gram-negative organism with the swarming motility, which is the responsible organism, that is Charlie, the Proteus. 45, the patient has increased hepatic glycogen with the normal structure of the liver. No increase in the serum glucose occurs after giving fructose. Which enzyme will be deficient? That is beta glucose 6 phosphatase. 46, which of the following is the hormonal dependent? It is prostatic carcinoma. Next, 47, the lady delivered a baby at the home, brought her 5 days baby with the fever, vomiting, and the neck stiffness. Organism responsible will be delta group beta streptococci. 48, of the following drug causes the tachycardia. The normal dose, it's pathogen. Next, 49, the female presents with the arterial disease. On examination, you will find the pulsatile mass on the abdomen. It originates from the Charlie L1, L3. 50, 45-year-old diabetic lady since 10 years admitted in the hospital due to the pneumonia and the developing shock-like symptoms. Cause will be increased vascular permeability. 51, SCR helped in the steroid senses as well as in the delta detoxification. Next, 52, the minimal absorption of the drug from its site of absorption for its desirable effect occurs if it is used for the local action. Next, 53, if the patient has a low cardiac output, he is most likely suffering from delta obstruction of IVC. Next, 54, depending upon the cluster of the differentiation, CD4 cells are the delta helper T cells. 55, the muscle causing the eversion of the foot is the peroneus longus. 56, the person doing exercise posture and the position is maintained in the moderate exercise occurs through the proprioceptions. Next, 57, the patient was taking aspirin, advised to the cardiologist. Surgeon wants to operate on his inguinal hernia. How many days the prior aspirin must be stopped? 7 to 9 days. Next, 50, the carcinoma causes the mutations. These genetic mutations are Charlie acquired. Risk factor for the development of malignant melanoma is the xeroderma pigmentosum. 60, PDGF is present. The platelets released from the Charlie, that is alpha granules. Next, 61, girl with the coarse facial features, gap between the incisor and the spade-like hands. What happens to the muscles involved in this disease? That is alpha enlargement. It's acromegaly. 62, the man bladder blood supply is which ligament? Alpha, that is the dorsolateral. Next, 63, the neck of the bladder in the proximal urethra is supplied by the delta sympathetic L1, L3 by the hypogastric plexus. 64, the post-op intra-abdominal bleeding following the lower C section. Most likely source of the bleeding would be the branchial uterine artery. 65, the layer of the viscera from the outermost to the innermost, it is beta option, serosa, subserosa, muscularis externa, submucosa, and the mucosa layer. Next, 66, how much tidal volume should be given to the anesthetized individual? It is basically twice to the normal. 67, which of the following closes the cranial sutures in the animal models? It is FGF. 68, worker is working near a nickel metal shop. Which carcinoma is being predisposed? It is the lung carcinoma. 69, a man with a plastic anemia is treated with a large dose of antithrombin globulin. 10 days later, she develops the fever, lymphadenopathy, arthralgia, and the erythema on her hands and feet. Which the following is hypersensitivity is most likely cause of this syndrome? That is the type 3 hypersensitivity. 70, the dietary iodine not utilized in the thyroid gland is excreted in beta, which is urine. Next, 71, 1. A patient breathing 100% oxygen, half-life of carboxyhemoglobin would be the 2 hours. Next, 72, the sarcoma is present between which of the following Charlie to Z lines. Next, 73, a man presented with the generalized body swelling for the 2 weeks. Physical examination shows the thick waxy skin, hepatomegaly in large kidneys. Kidney biopsy shows the apple-colored birefringence under the Congo red stain. It with multiple myeloma. 74, a 40-year-old male returned from the Bangkok, now complained of the non-tender penile ulcer in the palmar rhythma, generalized lymphadenopathy along with the regional rubbery and the painless lymph node. What is the suitable diagnosis? It is basically the secondary syphilis. 75, the following is the effect of the acidosis in the body. It is seen as depression. 76, the hormone action on the anti lobe of the pituitary and inhibit growth hormone is delta somatostatin. 77, when a firm stroke with a pointed object is applied on the skin, there is the spreading redness due to the arterial dilatation. This response is due to alpha the axon reflex. 78, the iron transport in the body is by the Charlie the transferrin. Next, 79, which of the following test to be done for the typhoid fever in the second week? It is the blood culture and the Vidal. Next, 80, the hypocalcemia leads to which effect on the heart? Is the systolic arrest. Next, 81, the two vertebral artery joined to form basilar artery. This is called basically the convergent. 82, the patient following outside hand causing pain in the trauma, the wrist accompanied by the mother. X-ray shows the bone fracture in the anatomical snowbox area. Most common feature fracture bone in this area would be Charlie the scaphoid bone. 83, the congenital hydrocephalus is due to the blockage in the cerebral aqueduct at the beta mesencephalon. 84, which structure derived from the pharyngeal arch? It is muscles of the mastications. 85, the following is the common tumor suppressor gene. It is alpha TP. 53, 86, the patient having diarrhea and the dementia, the dermatitis due to the deficiency of vitamin B3. 87, after vasectomy, the seminal fluid will contain the alpha, which is the seminal in the prostatic fluid. 88, the process of unlocking fully extended knee required initial contraction of Charlie popliteus muscle. Next, 89, the patient present the proximal fever, chills, time duration for the symptoms appearing was 36 to 48 hours. Ring and the crescent shape organism is involved, that is the plasmodium falciparum. 90, during pregnancy the lumen of the uterine cavity is obliterated by the fion of which of the following? Residua capsularis and residua parietalis. 91, the patient having the paralysis of the right side of the body with the deviation of angle of mouth to the left and drooling of the saliva, but the patient can close both eyes. Injuries at the level of alpha, there is a supranuclear level. Next, 92, the 35-year-old female having the mallow rash and the positive anti-DS DNA now develops proteinuria hematuria. The most likely cause would be E. lupus nephritis. 93, G3P2 with the two normal kids and the mother is having some chromosomal abnormality. Physical examination unremarkable. It is Robertson translocation. Robertsonian translocation. 94, the 4-year-old boy attended the clinic and was observed to have a short neck, low hairline, and the posterior aspect of neck was known to be suffering from the heart condition. X-ray revealed a cervical vertebra on the examination. Limited movement of upper limb was noted. What is the most likely diagnosis? It is Klippel-Feil syndrome. 95, the patient with Addison's disease presented the emergency with which complication? There is the hyperkalemic metabolic acidosis. Next, 96, the cimetidine interaction with the warfarin and may increase PT and cause the bleeding due to beta decreased hepatic range of warfarin. 97, the female presents with the hirsutism, hypoglycemia, obesity, weight gain, and the high ACTH level. Likely cause is Charlie ACTH overproduction. 98, the virus associated with the Hodgkin's lymphoma mixed solarity is Epstein-Barr virus. Next, 99, the during exercise skeletal muscle blood flow is increased by beta vasodilation by the local metabolites. Tachyphylaxis is diminished response to a drug rapidly. 101, after RTA GFR decrease in the patient came with the excessive bleeding. Cause of the decreased GFR is decreased arterial blood flow. 102, which of the following enzyme decrease in acute liver disease? That is delta pseudocholinesterase. 102, which of the following enzyme decrease in acute liver disease? That is the pseudocholinesterase. 103, the therapeutic window of the drug indicates range of the dose. 104, in hypovolemic shock, thirst is mainly stimulated by angiotensin 2 about respiratory dead space. Alpha, the filter, humidify, and the warm inspired air. 106, a 68-year-old woman with the uterine carcinoma undergoes a surgical resection. The cancer can spread direct the labia majora and the lymphatic flow that follow which of the following structures? That is E, round ligament of uterus. 107, the systolic arterial pressure is affected by the venous return to the heart. 108, investigation for the Hashimoto's thyroiditis is anti-thyroglobulin and antimicrosomal. Next, 109, the man residing near fast flowing river develops a blindness in the last 2 years. Gradually diagnosis of the nematodes infection was made. This is most likely delta onco circumvolvulus. 110, the heart heat stroke is associated with loss of the sweating. 111, the female having the UTI, gynecologist advised urine RE shows the pus cell. The organism in the is the gram positive, catalase positive, coagulase negative. Which organism is involved? That is Charlie, the Staphylococcus saprophyticus. 112, the terminal ileum resection causes increased water content in the feces. 113, which of the following disorder has repeated sequence of the trinucleotides? It is Charlie, the Fragile X syndrome. Next, 114, the 25-year-old female newly married presents to the ER with the fever and the burning, micturition, suprapubic pain with increased white cell count. The organism involved most likely is Escherichia coli. 115, the young patient blood pressure is 150/90, serum renin is higher than the normal. Which of the following stimulus further increased level of the renin? That is the sympathetic stimulation by the renal nerve. Early investigation for the leprosy is Charlie, which is a nasal scraping for the microscopy. 117, to the following paraneoplastic syndrome is associated with the small cell carcinoma of the lung. There is the Cushing syndrome. Next, 118, the true both the clavipectoral fascia is delta, the invest pectoralis minor muscles. Next, 119, after an incised wound on the front of the wrist, adduction and abduction of the fingers, lost sensation of the skin of the palm was intact. Nerve damage will be alpha, the deep branch of ulnar nerve. 120, which of the following would be expected to reduce the maternal behavior? Irritability, loss of expression of the phospho B gene. 121, a lengthy scenario and it is linked to the primary hyperparathyroidism. 122, the patient has developed the multinodular goiter. This is due to fluctuating TSH. 123, the secretion of hydrogen ions in the proximal tubule associated with the beta reabsorption of the bicarbonate ions. 124, the pain of the pleura referred to shoulder is by the C24. 125, the most common cause of inherited intellectual disability is beta, that is the Fragile X syndrome. Okay. Next, 126, the child has the generalized edema in the proteinuria. This is due to the damage of Charlie, the basement membrane. 127, the rectus sheet above the arcuate line is formed by the beta. External internal oblique aponeurosis. 128, the medial lemniscus is formed by the decussation of Charlie, which is internal arcuate fibers. 129, with regard to counseling, the best statement is delta. It is a technique to help people help themselves. 130, in behavioral sciences, the biopsychosocial model of the health care is best described as Charlie. Use of social and psychological factors alongside the biological aspects of illness. 131, as compared to the arterial blood, venous blood has more E, that is the hematocrit. 132, LP of the normal patient done. What will be the finding of CSF to differentiate from the plasma? That is delta low glucose. 133, the 20 years old young boy presented with the fever, headache, vomiting. He's having neck stiffness and altered mental status with the hallucinations. Which among the following is the brain eating parasite? That is Naegleria fowleri. 134, the fetal part of the placenta is delta, the chorion frondiosum. 135, the patient presented with the paralysis of the right limb and the right lower face along with the homonymous heminopia. Leon present is which of the following? There is the forebrain. 136, the patient came in the ER, the BP of 160, 100, having headache, fatigue and the palpitation. Lab reveals sodium 150 and the potassium 3. What is likely cause of his condition? That is the hyperaldosteronism. 137, the minor calces receive urine from the beta renal papilla. 138, which when the blood pressure is in the carotid sinus decrease, it will cause increase in the Charlie heart rate. 139, the virus causes the cancer alteration in the proto-oncogenes. Next, 140, the formalin is used in the patho lab for the samples because it prevents the autolysis. 141, the removal of some of the carbohydrates bound to the serum protein result in alpha aggregation, the precipitation. 142, the fracture of the lung bone will stop longitudinal growth, that is the epiphyseal plate. 143, the increased CA and the decreased phosphate is the action of Charlie PTH, parathyroid hormone. 144, the resting brain potential revert back to normal due to Charlie, the progressive opening of potassium channels. A patient presented with a pain in the right hypochondrium, nausea and the vomiting. Pain is going to shoulder and the upper back. Which condition is associated with it? That is basically cholecystitis. Next, the 146, the dorsal ramus of the C2 form alpha, the greater occipital. 147, after trauma, there is an injury to the iliac guanal nerve. There will be Charlie, that is the cremasteric reflux in the medial thigh sensation lost. 148, the anterior thigh sensation lost due to damage of it seems like it is wrong here, so it is the femoral nerve. you have to rectify it. 149, the interventricular septum thickness, septum to free wall thickness 3:1. What is the cause? That is beta hypertrophy cardiomyopathy. 150, the medial attachment of flexor retinaculum is the beta pisiform. Next, 151, the middle rectal artery is the branch of which of the following? There is internal iliac artery. Next, 152, after femoral hernia, repair swelling over incision site due to the damage of the femoral vein. 153, after sciatic nerve injury, which muscle will be sparred? That is the gluteus maximus. The dots stand for directly observed treatment short course. 155, the local anesthetic agent maximum protein binding is the bupivacaine. And 156, the patient has a difficulty in climbing and during swimming can do crawl. Which muscle is damaged? That is latissimus dorsi. Differentiate between the PCT and the DCT. It is the PCT has the brush borders. 158, while doing the surgery, the splenic vessel need to be ligated. That are present in which ligament? It is the lienorenal ligament. 159, an old patient present with an enlarged prostate and there is a marked increase in the PSA up to 20. Having the weight loss, MRI done and the bone mets observed. What is the route to spread of the prostate carcinoma to the vertebra? That is going to be the vertebral venous plexus. 160, after RTA, the patient having talking but no sense and understanding, something damage to which area? There is a Wernicke area. 161, the floor of the posterior triangle of the neck is formed by the prevertebral fascia. 162, thigh adducted, medially rotated and flexed by the sartorius. 160, the harshness of voice due to the damage of which of the following? The recurrent laryngiana. 164, the patient whose cuboid bone crushes by run over accident by the light vehicle, which muscle will be affected? The tibialis posterior. Next, 165, the middle carpal bone in the proximal row is lunate. 166, the carcinoid syndrome is diagnosed by 5-HLA hydroxyindole acetic acid. 167, the primary tumor causes more common increase in which of the following? The prolactin mean is defined as the sum of all observations divided by the total number of observations. 169, the cervical pap smear shows two-third epithelium has a typical disorganized cells with the loss of polarity, high Nancy ratio and the pleomorphism alpha. The moderate dysplasia. 170, a young group of the boys living in the daycare service, all of them are having malaise and the weakness and the restlessness during night. They cannot properly sleep due to the perineal itching. The cause of this symptom is introbius vermicularis. Next, 171, the SCG main function is the corpus luteum preservation. 172, which ligament prevent the extension at the hip joint? That is the iliofemoral. Next, last, the patient of asthma has the a pH of 7.2, bicarb 2.6 and hypercapnia. Likely acid base disorder is the respiratory acidosis. So thank you for watching my video. Do subscribe my channel. Until my next video, Allah Hafiz.